visit. So when you want to look into doing Invisalign, obviously, or aligning your teeth or braces, it's nice to go to a place that can have some technology that will show you what is possible and maybe some of the ways that we can kind of visualize the progress and what we're going to be able to achieve for you. That's why we take a lot of photos, right? So we start every cosmetic treatment or anything that's going to impact the smile, we start with a good set of photos. So we do that at the first visit for you, and then after that we take some great x-rays. We want to make certain that obviously we're not straightening teeth that are decayed or have issues that might be getting worse while you're in treatment. We don't want to see you have a toothache because we didn't find something early on. So we do that as complimentary in our exam when we're talking about doing Invisalign. And then we also take what's called a simulation or a 3D image with this machine right here called an iTero. It has a cool little camera that allows us to avoid, and you can kind of see here, allows us to avoid the typical impression technique where you're going to use a bunch of goop and almost choke somebody, make them lose their breath and all that goes along with it. What's really slick here is we can move this around in the mouth. It's going to take many images and create a 3D model. So we went ahead and fast forward. This is actually Chelsea's treatment right here. So we took this a couple weeks ago. We submitted it to Invisalign after we were able to go through the photos, come up with a solution that she loved, give her somewhat of a timeline, and we'll get more into the timeline, but that's one thing that's really cool about this is we can submit this through the internet immediately. So she's going, hey, I've got this pageant coming up. I don't want to wait too long in treatment. And if we're sending an impression through the mail, it's going to take quite a bit longer. And you get some distortion. So no distortion impression, immediately sending through the internet. And now we're able to see here in a very clear view when we move these teeth. And I don't want to break that. There we go. Okay. So if we're looking here close, you can see her upper and lower arch and bite there. And you can see the spacing and the gaps that we have on this left side of the screen. This is our before. It's our current condition. And then we do a simulated outcome here. And the simulated outcome is going to be basically taking the teeth and basically moving them in space. And it is a simulation, so it's not a guarantee of treatment. But if you're someone looking at moving your teeth and improving your smile and maybe getting a better, healthier, balanced bite, being able to visualize what you're getting is super valuable and I think encouraging when you know what you're spending your hard-earned money on. So that's why we love this. It gives us a bunch of different views. So you have the upper arch, you can see there, and we can rotate it so you can see it. And then her lower arch, and there's spacing, you know, not a ton, but some moderate spacing on upper and lower arch. And so you can see it simulates how we can close that gap for the patient. Pretty cool, right? Some other things that you might want to be considering when you're looking into the alignment of your teeth is if you have missing teeth, and I'll just get into that a little bit because I'm trying to kill some time, right? So if you have missing teeth, you probably have some shifting, right? That is there, and maybe you want to restore those missing teeth. So Invisalign is an awesome treatment for correcting the spacing and shifting that you might have from having a tooth that's been missing. Another thing is that we have probably, I want to say 90%, gosh, that might be a little high, but maybe like 75% of our treatment is ortho relapse. So it's the teenager who got braces, 16 years old, probably not the most responsible if anybody can relate. You can probably give a thumbs up or a like there. It's probably some people. By the way, definitely if you have questions, we're going to be fielding those. I just thought about it. Make sure you put those in the comment section, and we have a couple people looking at those, so that way we can answer your questions live today. And then after all of this, we'll obviously compile a video that'll be a little more, concise, cut out all the maybe stuff that was just a little long, but obviously we're doing something live, so it's gonna have some filler. But what I was talking about there with the teenager is that you're obviously gonna have some shifting if you don't wear a retainer. And so with that kind of an issue, Invisalign is fantastic for that, especially if we catch it early because we can do it very quick and easy. There's a lot of questions about what Invisalign can treat, and there's a lot of misinformation out there about what it can treat. It's pretty phenomenal what we're able to handle and fix. Matter of fact, in the next day or two, you'll be seeing a complete crossbite that we're going to correct with Invisalign, which is a lot of times said not to be possible, so that will be kind of cool. And so there's a lot of ways that the trays are more effective than they used to be. So if you've been told in the past that maybe it couldn't help you, you just might be shocked that it can. So don't hesitate to give us a chance to see you, give you an idea of if it's possible. So
while you guys are listening to Dr. Olson, what we did with Chelsea was we started to take her start photos. So we believe at Innovative Dental, the best part of any story are the photos. And in order to have a great story to share, which Chelsea has an awesome story, we need to take some really good photos. So that's what we were doing while he was over there talking. First part of the Invisalign, what we like to do is go over everything that you're going to get to take home with you today. We want to make sure that you are ready and prepared, that this is a breeze. This shouldn't be anything that you feel overwhelmed by. So we want to make sure that you have everything you have. I know for me, when I went through Invisalign, I was not a great patient and I felt very lost. So we never want you guys to feel like that. So you'll have a handout that has everything that we're going to go over today, so you can reference that if you're more of a visual person. You'll also get a hygiene pack here. Toothbrush, toothpaste, hand sanitizer, all the fun things. Also my information card. So anytime you need to contact me or you have a question, maybe on the weekend, that's when a lot of the questions are raised, you can hit me up with an email and I'll be able to respond to you, make sure that you don't feel like you're left out or anything.
I think it's better if you actually call her whenever you want.
Yes, my personal number will not be in the comments below. You are going to get some tray cases. So we recommend that your trays be worn anywhere from 18 to 20 hours a day. You're going to get the full benefit if you're wearing it towards that higher amount. Anytime they're not in your mouth, they need to be in one of these two cases. I'm dorky, so I always say red is dead, blue is new. So we want you to keep your current tray in that blue container and then keep the tray prior in the red. So when you switch out your trays every 3 days, when you move to tray 2, you'll put 1 into the red case and 2 in the blue. When you switch again, you'll throw 1 away, put 2 in the red, 3 in the blue. So you're just keeping the tray prior in case something were to happen, and if you're anything like me, that might happen to you more than often. So you'll have a backup just in case. And as usual, just call me and I'll help you out. And that'll be in your bag. So today you are going to get your Invisalign trays. They look just like this, and they're all individually labeled and packaged. These trays are going to correspond with the schedule that we printed out for you, so you'll kind of have a guideline of when you're supposed to switch out. And I'll kind of show you the difference between the upper and lower, but if one doesn't fit on the top, well, then you know that it's the bottom. So you don't have to worry about that.
And then a common question, Amanda, is can Invisalign be just upper or lower? And I'll let you handle that one.
Yeah, that's a great question. So we do get that question a lot. Can you just do one arch? We don't recommend it because your bite, like 4 wheels on a car, should be balanced, and it's best to do them simultaneously. That way we can make sure everything moves together in harmony. So that's the only reason why we recommend it, but you know, that's what we like. So awesome. So Chelsea, I'm gonna go over your ClinCheck just a little bit for you. Okay. And I know, did you go over that too already?
I did. I showed the simulation, so giving you a little insight into how the ClinCheck works.
Awesome.
ClinCheck is basically the simulation along with all of, here, I'll stick with it. It's along with all the steps. So from start to finish, like each tray, what it's going to look like, or what we predict it looks like, obviously. And so this is kind of that little video process. You'll actually get to see your smile changing. When patients come in periodically, that's what Amanda and our team will show the patient is the progress and make sure that it lines up with where we should be. So.
Cool. And we also use it to kind of check your progress too, just to make sure that you're on track. But you can kind of see here, this is what we're predicting your teeth to look like when we finish. And that's a combination of Dr. Olson's RX specialties and then what Invisalign simulates as well. And you'll kind of see here you've got some buttons, and those are going to be what's on your teeth today. And a lot of people ask us, well, do I have to have buttons on? Yes, you should. That's what sets Invisalign apart from other appliances, is the fact that we're able to actually rotate and move teeth more predictably by being able to grab onto those. And those kind of act like a bracket or that pressure point. So you'll also have one that's built in on the upper 2 in the tray, and that's what makes Invisalign so great, is that it has all this smart technology in it that integrates with your attachments and helps move the teeth. So we're actually going to put those on now, so I'll just lean you back, and then if it's too far back, just let me know.
Okay.
Cool.
So while she's doing that, I'll maybe hit a little bit on the attachments aspect, because I think that's a good one.
Yeah.
So attachments in a clear tray obviously have to be provided by a dental professional to be able to, because they're made out of a clear resin, or basically a tooth colored resin. So they're really invisible. The red on this ClinCheck, they're obviously not going to be red in the patient's mouth. You guys will get to see that. it's going to be just, they blend right in, especially when you have the trays in. But what they do is they allow us to take teeth and move them in multiple different directions other than just tipping. There's a lot of aligners that have come to the market. They don't have patents and they don't have licensing to be able to do what Invisalign's been doing for, what, 25, 27 years, somebody from Invisalign, yeah, a while. And so they've advanced a ton over time, and they have all these patents that allow them to make these, you know, movements like pulling a tooth down or pushing it back in or rotating it. Those are all more challenging movements. Or if the root is off axis, being able to move that root in a different direction. This treatment here is fairly simple, so you know it's not going to be some drastic change as far as really complex, difficult movements. That's why it's what total 10 trays, I think.
Yes.
And you just tell me when you're ready, Amanda.
I'm good. We're
Cool.
just putting on the buttons now.
Right.
So it's a really simple process. It doesn't hurt at all. It's just a lot of air and water. We like to prepare the teeth and make sure that they're bondable. So we're just going to clean them off with some shampoo.
Shampoo.
Well, it's kind of like
Hey, I like
it's
that.
like dental shampoo. It's kid friendly.
Kid friendly.
Yeah. And so there is nothing painful with this process. Everybody gets really panicky during this part because they're leaning back, but it's really simple and it goes fairly fast. All of our team here is equipped and smart enough to do it really fast for you. Very well trained. A little bit of air and water.
Do we have any questions yet that have come through? I don't know if we do. None? Yeah. So if you're interested in Invisalign and you're not in the Springfield area, can you hear me, Michael? I don't know because of the suction. Can you hear me? And you're not in the Springfield area and you're maybe watching on YouTube live and you're going, hey, I'm not interested in maybe making that trip. We do actually help people out of town, but if you're looking for a local dentist or orthodontist that provides Invisalign, you can go to the, I think it's just the Invisalign website, right? And there's Find a Doctor at the top there. You can click on that. And what you want to be looking for, because they keep changing their statuses, but what you want to look for is preferably an office that is a platinum provider, and then they've got a few other designations as well, but one that's going to have a lot of experience, and they designate that there on their website. So that way you know you're going to a place that's comfortable with the process, has seen what it can do. If an office is not doing very much Invisalign, they're not going to know what it can and cannot treat. And that was our experience back 4 years ago when we started, 5 years ago now.
Absolutely.
And we didn't know all the things it can do, and now we do. We've got obviously picture proof of that. That'll be kind of cool to see in that video. The smile of the week for this week is going to be an Invisalign. I think I introduced it last week as that tooth and crossbite. So I think they even have on their website you can put in your conditions like deep bites. They have narrow, mild crowding, moderate crowding, severe crowding, all that. And then this right here would be probably designated as mild spacing to moderate spacing, upper and lower arch.
So we're just getting ready to put the buttons on. So we use a composite base here, and it's a flowable form because it's easier to put on the teeth. But we just fill in kind of like a template tray or a tracer tray that allows us to put the buttons exactly where they go on the teeth. They are very tiny. They're going to feel a little weird today, but as you take your trays in and out throughout treatment, the buttons run on pretty significantly, so you hardly even notice them. A lot more invisible than what a typical bracket would be. And buttons aren't on every single tooth, but for every person in Invisalign, buttons are different. So they're custom to each patient that goes through Invisalign treatment. So just because your friend has one on one tooth doesn't mean you're going to have it on the same. Awesome. Great job. I'm just going to use this curing light. It's going to help us set up that material. So I recommend that you keep your trays away from pets and small children. Both will cause a lot of damage on them just in a matter of moments. If something were to happen, again, just let me know and I'll help you figure out what to do.
That's great, Amanda. So what happens if and when somebody loses a tray?
Well, the first step they should take is to calm down and not panic. The second step is just shoot me an email and I'll go ahead and order your tray. They typically take 2 to 3 business days to be shipped and is seen as an emergency through Invisalign. So we'll get you that tray pretty quickly. But that's also why we recommend you keep your tray prior in that red case. That way if something does happen unexpectedly, that you have something to go back to.
Right. There was a good question there, and I think this is probably one many have. Is our general dentist allowed to put braces on patients? And the answer to that simply is yes. They have to. Now, obviously, we're here. We're not doing braces. We're doing Invisalign, but we also do braces in our practice. But you can. Now, the standard of care still has to be achieved, right? So the whole point of, like, I place implants, which many times are placed by oral surgeons, but I choose to place those here in our office with a really cool technology. And so general dentists are actually licensed to do all those treatments as well, but they have to obviously get the training and experience to be able to provide the care to the standard of care. And what that standard would be is as if a specialist were doing it. And so obviously we're delivering an amazing result for our patients and living up to that standard, so that's important. Amanda, what's the craziest story you had from an Invisalign patient?
Oh.
No names, please. No names.
As far as losing a tray?
Yeah. Chelsea, this is too bad. You probably are like, you got lots to say, I'm sure, and you got this thing in your mouth. It's not hurting you at all, is it? Just kind of weird. Yeah. It's good for that game speak out.
Yeah, absolutely.
Like get it to say ibuprofen or something like that.
Tylenol only, Dr. Olson.
I know. Sorry.
One point through Invisalign, especially since we provided an accelerated option, we always recommend that our patients take Tylenol whenever they need any type of pain management. Anytime you move teeth, and especially since we're accelerating the procedure, acetaminophen is best instead of using like ibuprofen or anti-inflammatories. Because for us, we like inflammation right now.
And why do we like the inflammation? I'll get into that a little bit, but maybe we should just go cover that now. I know Patrick Toll is watching. He's got to be watching.
Oh, I hope so. Hey, Pat, what's up?
What's going on? Oh, and I didn't even say hi to Mom. Hi, Mom. Hi, Mom. I don't know. I think she has Facebook.
I hope she's watching.
Yeah. So there's some cool technologies out there. One of them that is awesome is that allows us with moving teeth. And we use it for braces and Invisalign. I'm kind of moving this away from me. I'm sorry. It's called Propel. Propel is an amazing tool that allows us to basically perform a biological trick when we start treatment, and that trick will basically get the bone to remodel and change over faster. So when we're talking about trying to move teeth fairly quickly in time, that way we're not in treatment for years. Instead of years, we're going to be in treatment for months, and instead of changing trays out every couple of weeks, we're able to change them out every 3, 5, 7 days. And we base that based off of treatment complication. But this Propel is a way of us going in between the roots of teeth and basically putting a small dimple in the tissue there that basically stimulates the bone to respond by turning on the cells that change over the bone. And that inflammation that occurs is super effective. This technology has actually been around for a while. To give you a little bit of the backstory since we got some time, it used to be, well, not used to be, it's used a lot in orthopedic medicine for bone injuries. In that way, if you're a professional athlete, you need to get back on the field, and costing the team, obviously, lots of money by not getting back out there. You can have, if you have a fractured bone, they might dimple around the fractured site to cause the area, not just the fracture, but everywhere around it, to be get lots of blood flow and heal at a faster rate. And this company, Propel, goes, hey, wait a second, that's pretty slick. That's working really well for professional athletes. We're moving teeth across the country in orthodontist office and general dental offices. We're doing with braces and Invisalign. People are in treatment for years. Maybe we could make a difference. And sure enough, the technology, we've proven it over and over again with our patients. I think we've treated somewhere in the range of 500 people with Propel, over 1,000 people with Invisalign, and we can attest to it. We're able to move teeth in a much smoother, faster fashion with that. Sorry, did you have something?
What if I move on to the next tray and it doesn't fit?
Oh, cool.
Awesome.
I'll let you do that one. What if we move on to the next tray and it doesn't fit, Amanda? What's the
That's
answer?
a really great question, and it happens sometimes to our patients. What we recommend is that you don't move to the next tray, that you stay there, and that you, again, contact us and let us know. You're given a little device called a Chewy, and we'll actually go over what that looks like and how to use that here in just a few moments. But you'll need to bite down on that, and if you're not getting the tray to seat completely, then let us know, and we'll get you into the office. That way either myself or one of the other assistants can take a look and figure out what's going on. But good question. Awesome. So now that your trays are on, we are going to have you do like a little rinse here. This is an antibacterial rinse. It's going to help kind of clean the gums off and make everything nice and pretty.
Okay.
And then
So what have we done so far?
so far, good question.
Yeah.
So far, what we've done is just put your buttons on. So we haven't done the Propel yet, but all we did was put your buttons on, and they're tooth colored, and I know they feel a little weird, but they're kind of hard to see, and I don't think you guys can see them even at home, but yeah, they're just on there.
Okay,
So,
awesome. That
cool.
was easy. That was the part I was kind of nervous about.
Really?
Mm-hmm.
Well, I hope it wasn't too bad.
No, I
And
didn't.
they
didn't
do
feel
actually
it.
get like smoother. I've had treatment too. They
Yeah.
get smoother over time. So
Yeah.
And then do those come off eventually?
yeah, we'll
Yes.
polish this
Clean
off
design?
at the end.
Yep, when you're finished, they'll just polish off. Again, it's filling material, so it's really easy. It's meant to be in the mouth. There's a lot of questions that I get all the time too is it safe? It's absolutely safe because it's what we would use to rebuild your tooth if you had a cavity.
Oh, okay. Cool.
I'm going to let you swish
Thank
with
you.
that for about 30 seconds.
Okay.
And then you'll actually get a bottle of it to take home too, and you'll use this for the next 3 days, morning and night, for about 30 seconds at a time. Yep, you're good. Great. And great. Good. And I'll take that. Thank you. Awesome. All right. So what we'll do next is try your trays in, and I have a here. There we go. All right. So this is really easy. I'm going to show you how, and then we're going to let you do it yourself. You don't have to do it how I tell you. This is just a good starting point.
Okay.
But this will be your upper tray, and this will be your lower. If you ever need to distinguish it, the logo is always on the left-hand side.
Oh, okay.
There you go. They are extremely durable, so you don't have to worry about breaking them because they are very nice and firm.
Awesome.
So when you go to put your tray in, you're going to line it up with your two front teeth just like a puzzle piece, and then taking the base of your thumb, you'll apply pressure in the center, working all the way back until the tray is fully seated. To remove the tray, you'll take your index finger on the back there, and once it's off the tooth, you'll kind of pinch and pull down and away from the teeth. Same thing on the lower, just reversed. You're going to use your index finger to seat the tray, and then your thumb to remove it, again, pulling it out and away from the teeth. So I'll give you that, and I'll actually hand you the mirror.
I want to see the buttons too.
Yeah.
You can't even see them. Okay.
There you go.
So in the middle here.
Yes, just like so.
Like that?
Mm-hmm. That's perfect. Good, great job. And sometimes you can kind of feel it pop into place. Good. It might be a little
Like that?
tight. Yeah. That's perfect. There you
Good?
go. Yeah. There you go. So I'm going to give you that so you can kind of see how they're nice and fitted. I'll go over what a chewy is. We recommend that patients use these, 15, 20 minutes throughout the day, kind of break it up. But you'll use them anytime you will put your trays in. So you want to bite down on them, and I'll show you how we want you to. But you can also, because you can't chew gum with your trays in, you can't do that.
Okay.
So you can cut it in half and actually chew it like gum, and it kind of simulates that chewing motion.
Okay.
If you want to take a look here in the mirror, I'll have you open, and you'll bite down nice and tight for me. Good. And then again. Perfect. And you kind of see just a little bit how the tray goes up. Perfect. And bite together again. Awesome. So keeping the chewy parallel with the teeth, and now your trays are in completely. and you can look and they're completely fitted. There's no spacing or gapping. And when you move through those next trays, when you ask why does a tray not fit, if you see gapping like that, that's when you contact me and stay in that current tray.
Okay. Awesome.
Cool.
This is so, it feels so different to have it, but
Great. Do you want to try and take them out?
sure.
Yes. Yes.
Okay.
Because we'll get you numb here in just a minute.
Oh goodness. Okay.
Yeah. And
so,
I'll
starting at the
I
back.
go to the very back. Yep. And just kind of pop one side down. Good. That's perfect. And go the Invisalign slurp. There you go.
Oh, sorry.
Nope, you're perfect. That happens, and a lot of patients ask if there's a way to help with that, and you just kind of at the very end when you take it out. You are going to be a pro at it, though. Today's kind of difficult and different, but you'll be surprised how quickly you'll get the hang
It's
of it.
a lot easier than I thought it would be.
Really good. I hear that a lot, but it's good to hear it, on camera too.
Oh,
So.
but I think one of the buttons may have come off.
In your mouth here, or just a piece of flesh. Let me see. Does it feel like it's on your tongue?
Oh no, here. It
Oh.
came off.
Just a piece of flesh. You're good.
Perfect.
Awesome. Yep,
Great.
I'm ready for you to get her numb. Yeah.
Okay. All right, so if you're wondering why I've got, this is the part you're looking forward to, right? I'll be really gentle, I promise. And
Okay.
obviously, I'm going to be as gentle as I can anyways, but we're live. I want you to be able to be honest and be like, that wasn't that bad at all. So, all right.
Yes, I'll be honest.
It will be super weird, I'll tell you that. I've had it. I've done this actually on myself. There's a video of myself. Did you watch
Yes.
it? Yeah. Yeah.
That
If
was-
you're wondering
that was a
why
fun
I'm
day.
like all black, is as a child I wanted to be a ninja too, so this way I can kind of feel like a tooth ninja, right?
Should I put the sunglasses
Probably.
back on?
Yeah. That would be fine.
All right, so I better get this over so they can see. Good there, Michael? All right, Amanda, take it
Yes.
away.
Oh, this is the part I was hoping you were gonna
No, I'll let everybody know what we do for this is in between those front teeth there, on top and bottom, where we're going to want to see those gaps close really quickly. We'll go in between the roots of the teeth and do a little dimple. You'll barely bleed at all. I promise you that. It's not going to be bad at all. And then it'll stop real quick, and that will start that trigger that biological response, right? And so then after about an hour or two, you'll fully get your feeling back. You might be a little tender, but it really shouldn't be that bad. Okay.
Okay. Great. And a lot of times we have a lot of questions about Propel and patients wondering, why do we do it? I think Innovative Dental's number one answer is the predictability. We love that we get to do treatment accelerated, but our favorite part about that is the predictability that it provides to your treatment. So when we're looking at your case and you're seeing the end result, that we're able to be more accurate with that end result. It also makes the treatment more comfortable for our patients, which who doesn't love that? So when you're switching your trays throughout your treatment, the first day in your tray is not as uncomfortable as what it used to be. Especially speaking from somebody who used to switch their trays out every 14 days. And every tray at the beginning of day one was awful, and the trays were gross. I love Accelerated Invisalign for that, for the predictability, for the fastness, and for the fact that it doesn't hurt.
So Amanda, tell what did we decide on the time frame for tray changes here? We're gonna do 3 days, correct? So
Right, we're doing a 3-day change for Chelsea because her movements are closing spaces. So when it comes to different movements throughout treatments, we recommend either 3 to 5 days. Some cases that are more severe, we'll bump it to 7, but that's kind of rare. We determine that based on significant rotations, significant movement, deep bites where you can't see the bottom teeth. So depending on what we're trying to do for the patient is kind of like how we decide what we're going to do for each patient. Everybody's different, and we believe that everybody should be treated with the highest quality of care. So when it makes sense to do a 3-day change on somebody that had a tooth that was extremely rotated. So we just want to make sure everybody has a custom treatment plan, and we take a lot of time and preparation into that for them.
So if they're wondering why it's going to take me so long, because it'll take me about 5 minutes to get her numb.
Right.
It's because when you rush anesthetic, that's when it hurts. So if you've ever been in a dental office and you've been given a shot and your toes are curling, likely because the shot has been given way too fast, and it'll really burn and sting. Whereas I can promise you, Chelsea, you probably felt a small pinch, but it dies very quickly, especially if I give it slow. So an actual injection should take about a minute and a half per carpule. So just takes a little bit of patience, but I call it the golden rule injection, right? You give it as if you were giving it to yourself, and hardly anybody that's had felt an injection too fast would give one that way. So doing it right there.
Right, so is that why I felt that one day when you fixed my tooth?
I was trying to get you back.
Oh, okay.
Amanda smarts off to me, so I got her back with that.
You know,
Filling.
if I didn't, it'd just be me and Alexa, so.
I wonder, has
Okay,
Alexa
gotcha.
trolled the page yet? Alexa,
I know,
hi.
I was
Hi,
like,
Alexa.
hi, Alexa, miss
Yeah.
you. See her tomorrow. She'll love the shout out.
We'll pinch there. Good job.
So a lot of people wonder what's included with Invisalign. We include quite a bit with our Invisalign because we feel like you should have it, and it's fun to be able to provide that for our patients. So at our office, when you finish Invisalign, you're going to get custom set of whitening trays. You're also going to get retainers, and we include the Vivera, which are 4 sets of retainers that last you like 20, 25 years, which is really awesome to be able to have a retainer that will last with you that long. The number one person that we see in treatment are people that have already done ortho but maybe lost their retainer. So it's really cool that we're able to help them keep that smile when they finish. We also do some smile contouring or bonding. So we just want to make sure that the smile looks beautiful when you finish, and a lot of times that goes beyond just straightening teeth. So we want to make sure that you're happy and that Chelsea is happy with the investment that everybody's made with us.
So that along that philosophy, we feel like there's a lot of pricing structures with Invisalign braces as well, where you get a lot of, especially like whitening and then retainers are at the end, and so budget wise, you may not have thought about those, and we just include them that way. You don't have to be surprised at the end, and we can finish every treatment what we feel would be the best result, right?
Right.
So you're doing awesome, Chelsea. Another little pinch there, but you doing okay?
Mm-hmm.
Good.
You're doing a great job.
So I didn't tell you this, Chelsea, but we're gonna want you to like take a video and vlog a few times throughout this, right? It's only like what 30 days of treatment, so
Yeah.
it's not like you're
It won't be a very long.
2 vlogs every that's what once every 2 weeks you'll be done. It's crazy.
Yeah.
So
Pretty
if
exciting.
it was 14 days, which is Invisalign's older protocol, that would have been roughly.
5 to 7 months is what
Yeah,
the treatment.
I don't
came
want
back.
you doing math, Amanda. Don't worry about that.
It was on the sheet. Don't worry,
It's
everybody.
140 days. So
the
we'll pinch right
the
here.
sheet actually recommends 5 to 7 months, but that's non-accelerated, so that would be their yes, not mine, not my math skills.
So obviously, if you're listening to that, you're going 5 to 7 months. Braces would be at least that. Why is Invisalign so much faster? Obviously, we're talking a lot about Propel, but there's another factor. Invisalign treatment, once it's started, it is largely controlled based off of patient's ability to change the tray. So we give you enough trays to be able to change them when your optimum movement has already occurred. So movement of the teeth, the amount that each tray is only moving, it's a maximum half a millimeter, or sorry, a quarter of a millimeter movement. So we're not even, each tray is not going to take the teeth and move them too far, but that movement that we're asking the teeth to have is only going to occur for about 3 to 5 days. So after that, all that's happening is that the teeth are being held into position, and you can imagine that's a lot of wasted time if we can keep moving, right? So that's what's nice about Invisalign. We can have our patients change the trays out on their own at home and give them enough that they can make it to their next visit, and they can kind of gauge tray changes there. And Amanda, I think that's a really important question. We've learned a lot about how to do that. Give the audience there like a little idea of how we think through tray changes and when not to, when to.
A lot of the times, it sounds like a confounded statement, but you'll kind of just feel when it feels right. The trays will start out tighter when you first put them in. And over the course of the next 3 to 5 days, they'll start to loosen as the teeth move into the position of that actual aligner or tray. So you'll start to feel like it's ready to come out and move to that next tray. A lot of times people are like, well, do you just switch them out every 3, every 4, every 5? Well, yes, but no. We really want the patient to really be in charge of owning how their teeth feel and how the trays feel, and so we give a guided recommended amount, but the patient really is the driving force behind that. Also, if you're wearing the trays anywhere from 18 to 20 hours, you should be able to switch. We all have those days, myself included, where we weren't exactly the most compliant patient. Maybe you had a wedding, you're going out to eat with your friends, you didn't wear it as much as you should have. So we go ahead and just wear that tray an extra day or add on a few hours until it feels like it's the correct time to change. Invisalign should be great and transform your life, but it shouldn't be completely life-altering.
Yeah.
You're doing awesome.
Yep. We're fully numb on the top.
Feels
Feels weird, right?
Uh-huh.
You can't feel your face when you're with me,
I knew
because
this
I'm no
was coming.
dentist. Well, whatever. I know I shouldn't sing, guys. I get it. I get it.
That's okay. We
Yeah.
hear it every day,
I don't want to let anybody down that's watching.
like Alexa.
It's better when I sing it in falsetto. You'll have to come in on a regular day to hear me sing that in falsetto.
It's well worth it.
Yeah.
Well worth it. There are numerous employees that sing.
Adam's got nothing on me. Adam Levine. No.
Oh, I don't know. That was a little bit of a
He's got
stretch.
a pretty good falsetto.
I thought that was just like how high his voice
No.
went. No? Wasn't sure. I've been working on my dad joke skills. I think you're gonna be impressed.
Really?
Yeah.
All right. That's it. We are fully
Yay.
now. Pretty wild, huh? Feels weird.
It feels weird.
I promise you it feels more weird than it looks, but
Right. And the anesthetic that we give to, just to hit that quick note, it wears off a lot faster than what the anesthetic you would get for a filling or a crown. That typically lasts, 5 hours or so. This is going to wear off over the course of the next couple hours. So it'll be a lot less than what you're used to.
When people think about getting Invisalign, when should they schedule it? Can they go back to work? I mean, what do we kind of tell them about that?
Right, we recommend that if you are going to get Invisalign that day, that you just take the day off. We want you to be comfortable, and everybody handles it differently. So if you know that you maybe would not enjoy that part, then go ahead and take the day off. We want you to go watch some Netflix, tell us about the next time you come. But just take it easy. It's really not that bad for some of us, but there are some
One of the main
employees
things
who-
would be speaking, right? I mean, so
Right, so like if you have a meeting, don't do it because you're going to be numb for a couple hours. So just go
Yeah.
home and hang out. Schedule your meeting in the morning and your appointment later.
people are going to think that you went for a long lunch hour and had a few cocktails if you come back to the office, possibly. So,
Possibly.
all right. So you're feeling good and numb everywhere there, lower lip, right?
Yes.
All right, and upper lip here.
Yes.
Good. What you should expect here is just a little bit of pressure, nothing sharp. Okay. If you should feel anything at all beyond just a little bit of pressure, you raise your hand. I stop immediately. Okay.
Okay.
All right. And with this Propel device, we really don't have to do much. It doesn't have to be a large dimple. It can be very small to be effective. It's been great.
Kind of like the macro fracturing process.
Yeah. Did
Kinda
you
like
feel
a
it at
spider
all?
web.
Good. Good job. And so for each treatment, well, I kind of gauge based off of the movements we need. For this here, we're not moving teeth a ton, so we don't need as many dimples. Sometimes if we had to move a tooth a large distance, I might do a few more. So it just kind of depends on the case by case basis there. So.
Great job.
Doing okay there?
Uh-huh.
Good. I believe Propel has a finder on their website as well.
They do.
Yeah, so if you're wanting to find an office that offers the latest in accelerated orthodontics or Invisalign braces, then go to Propel's website in your area and you can find those providers on their website.
Great job.
Yep. We're done on the top. How was it? Not too bad? Didn't really feel anything at all, right?
Nope, didn't feel anything.
Good. As promised, good.
Great job.
I think it would be like really good just, you know, to maybe tonight, tomorrow, vlog something and just, you know, be
Yeah.
real. Like if you're sore,
Yeah.
tell them.
Okay.
If
Yeah.
you're, and you can send it to us, we'll upload it.
Awesome.
Yeah. We'll edit out the spot where you said that we were sore and then we'll upload it. Just easy.
With Propel, it's not uncommon to feel a little sore whenever the numbness wears off. It's kind of relatable to like burning your mouth on a hot piece of pizza or maybe poking yourself with a chip. Your gums are just a little sore, but most people bounce back within 24 hours. You know, the next day they feel fine.
Or you can be in treatment for 5 more months.
True. With 14-day smelly trays.
That's another thing. When I was in Invisalign, I might as well share this while I'm doing this, but when I was in Invisalign, you know, one thing is you're kind of going, okay, what can I drink? When can I drink certain beverages? And what's safe for when I have my trays? And one thing I would tell you is kind of nice is you can, as long as it's not a severely staining beverage, you can have it in a short amount of time, take the trays out, rinse, and put it back in. I mean, it sounds kind of wild because most of the advice would be, hey, don't even have coffee. And I had a lot of black coffee every morning, and while I read or get up in the morning before I go to work, and I would drink coffee and just take the trays out, rinse, and by the time the trays are staining, especially when you're talking 3 to 5 day tray changes, they're not even really that noticeable. So you kind of buy yourself an extra 30 minutes to an hour of wearing the trays, which, you know, that adds up, right? If you think about it, every time you have the tray out is time you're kind of going the opposite direction. So you kind of want to limit that as much as possible. So having some of those beverages that maybe are very low in sugar and can be had over the course of maybe 30 minutes to an hour and rinse, that's a good way to go about it. So we are done with Propel, so that's the whole process. Pretty quick. I kind of was talking, going slow. It usually takes a couple of minutes, maybe not even that. I think Patrick's, like, every time he's here, he's got his stopwatch out, trying to see how fast we do that. But
We'll time
it's
it next time.
it's a few minutes. But you were great. Way to go.
You did awesome.
You either didn't feel anything or you fooled me and everybody else.
No,
So.
I didn't feel anything. The
Good.
worst part is that my face feels like
Yeah.
3 times wider.
Doesn't it? It's kind of like, remember like in grade school when you played dodgeball?
And you get hit.
And I'm sure like, yeah, you get
Yeah.
nailed in the face and you're like, can't feel it for a while. Awesome.
Awesome. Good. Alright,
There's
so
not much else to talk about here. We have
No.
some questions that we had. Checking those out.
I'll put your trays in for you. Not that one. And we'll just get you set up. There you go. You did awesome.
All right.
Are they in there? Both of them?
Yes. Look. Yeah, almost. There we go. Cool.
There you have it.
Awesome.
You really don't look that much different. You just can't express
Yeah.
yourself.
Yes, yes.
It's just you had some really bad Botox. That's what it kind of looks
Yes.
like.
Well,
So,
Awesome.
all right. Yeah. So that was our first live event. I could probably just stand where you can see us. So thanks so much to Chelsea Arnold for letting us do that. I think that was. I mean, I know if I was a patient looking at Invisalign, that was probably informative and gives me some insight into what to expect. I'm sure every office is a little different than us, but that gives you an idea of, especially with Propel acceleration.
Right.
Cool. Anything else we needed to wrap up? Any other
Was
questions?
it close up?
Yeah.
She stayed up.
Yeah. Yeah.
Yeah.
Stand up and we can get a close. You want to get a close up for the screen there?
But
Yeah.
we're trying this one.
Yeah.
oh my goodness.
Do you have any emergency? I don't think so.
I don't think so.
No. Yeah. Look at that. That's awesome. You can kind of see what the tray's in. You bet you-
Shut the TV.
Huh? Show the
You
teeth?
show like
Yeah.
your upper here.
Yeah, and help. She'll help with that.
Yeah.
You're so tall.
I know.
You're like,
And I'm
Sorry.
sorry.
and you're so short.
I can
I'm
sit
so
down.
No, you're good.
You're okay. I delivered like a 7-foot tall.
Wanted to show what the trays look like while they're in, right, Michael? That's okay. All right.
There we go. Oh, yeah. We can come closer. Here we go. Is that okay? Sorry, I know you can't feel your lip.
It's okay.
Good. Is that okay?
All right.
Yay.
Until next time.
Thank you.
Bye.
Bye.